You've probably heard the phrase Mar-a-Lago face. It's not a medical diagnosis. It's a media nickname for a detectable aesthetic. But here's the twist. These facial changes are everywhere now, not just in politics. I'll break down the features and the procedures, from Botox to facelifts, why some results read overdone, and how to stay natural. The label Mar-a-Lago face rose through opinion pieces and commentary, not peer-reviewed medicine. It might be useful as a shorthand, but it can over-politicize what are really technique and styling issues. So let's depoliticize. We'll look at features, surgical and non-surgical tools, and proportional harmony. Filters, selfie lenses, and normalized med spas and surgery often will push faces towards similar templates. High contrast makeup and aggressive tanning amplify what injectables and surgery already do. Political figures are visible examples, but the patterns are seen across entertainment, influencers, and everyday media. HD lights can exaggerate planes, and short distance lenses can inflate the size of the midface or the lips. Studio makeup and deep tans create color bands that outline filler or surgical edges. Let's review the features that constitute Mar-a-Lago face. Let's start with the upper face, specifically the brows and forehead. People want their eyes to appear more open, for their foreheads to appear smoother, and they often want the tail of the brow to appear more lifted. One way to do this non-surgically is through the use of neuromodulators, such as Botox. Filler can also sometimes help with lifting of the lateral brow. When it comes to surgical options, some people get brow lifts and or blepharoplasties to help open up the eyes and raise the brows. But there are various signs of when things are overdone, and that could mean a frozen type of facial appearance. Sometimes the medial or the lateral brows get over elevated, and the upper eyelids can sometimes appear hollowed out or skeletonized, which can actually lead to a more aged appearance. So the key to staying natural is to go with microdosing of Botox and or filler, to do very conservative amounts of skin removal on the upper eyelids or around the brow area. And it's important to match brow shape to someone's age and gender. For example, you don't want to overarch an eyebrow for a man. Now, when it comes to the midface, people are chasing a youthful contour and lift. Non-surgically, this can be achieved with filler placed deep onto the bone in most of the areas of the midface, other than the medial cheek, where it's usually placed a bit more superficially. Other than HA filler, there are other biostimulatory options like Sculptra, for example, that we've covered in a prior video. There's also fat grafting that some people opt for. Surgically, the main technique to lift the midface is either a direct midface lift through either an approach around the eyes or doing a full-on facelift where you're actually increasing the midface lift in addition to addressing the lower face, such as the neck and the jowling. And some people get implants inserted into their cheeks for that added appearance of contour and volume. When this look is overdone, some people end up with a malar shelf. They might have the appearance of an apple in the cheek, and sometimes when they smile, their midface might not move. One way to keep the midface looking natural is to do the surgical work first to set the structure and then build on it with some additional volume if needed. Also, it's important not to overdo the medial cheek volume because that can sometimes give off a less natural appearance. And the key is to use small blended volumes of filler, if any filler is used at all, instead of large volume filler that can then give a pillow face appearance. When it comes to the lips, people are looking for that youthful hydration. They also often want more definition and some additional tooth show. It's not always a larger lip that people are after. Non-surgically, we have HA fillers that can help accomplish some of the goals of augmenting lips. Some people also get neurotoxin around the perioral area to enhance different features. For example, a lip flip approach where a few units of Botox are placed into the actual vermilion border to help flip the lip to some degree. It gives you a little bit more pink show on the upper lip. Another approach is to use some toxin into the DAO muscles that can help reduce that kind of frowny appearance that some people might have to give a more neutral or kind of upturned oral commissure appearance. Surgically, of course, we consider a subnasal lip lift when we're looking to shorten that philtral distance, evert the upper lip, add some additional upper tooth show. Also, a corner lip lift might be useful in some select cases. The overdone look comes in when the vermilion border looks blown out, where you lose that definition because the filler has migrated. Also, sometimes lip filler leads to some lower face dominance, and that usually means when the lips are overpowering other structures such as the chin. And excessive lip lifting can give you various complications such as a whistle deformity. So one way to keep the lips looking as natural as possible is to assess that upper tooth show first. Filler might not be the best solution if you're looking to increase that upper tooth show. Sometimes a lip lift is a better way to go initially. And then filler can still be brought in to increase the volume further of the upper lip and sometimes to shape it better. You have to keep in mind your upper to lower lip ratios. Typically, the lower lip is a bit bigger than the upper lip. Sometimes you can have a 1-to-1 ratio, but as the upper lip gets much bigger than the bottom lip, it sometimes can look less natural. When it comes to the jawline and chin, people are looking for a stronger type of appearance that could signal a more youthful look. And the goal is often to improve that chin-neck transition. Non-surgically, sometimes you can do this with filler to augment the chin and jawline. Submental lipo is sometimes employed to reduce the fullness of the neck, and that can often also bring out that sharper, crisper transition. And sometimes radiofrequency microneedling or other energy devices are used to accomplish the same type of goal. Surgically, some people get genioplasties or chin implants to augment the chin. Some will get implants into the rest of the mandible in order to bring out that definition. And some people will get neck lifts, sometimes deep neck surgery along with that, to reduce that skin laxity and bring back that crisp type of transition. The overdone look typically leads to a widened face that looks heavier on camera. It can give off that blocky lower face that some of you may have seen. Sometimes implant edges can be visible, which also looks unnatural. There's also the potential for a witch's chin. So to keep the jawline and chin looking natural, it's important to focus on contour rather than just sheer size. And even though some people look to avoid surgery, it can sometimes give you a more natural appearance than getting a ton of filler into the lower face, which can ultimately actually reduce that smooth transition. And it's important to keep in mind that some people, even though they're looking to avoid surgery, surgery has the potential for giving them at times a more natural type of appearance than when they get a whole lot of filler injected, which can often blend into other areas and actually can reduce that smooth transition from the chin into the neck. And while men and women are chasing that boxy jaw in the West, it's different in Korea, for example, where that more kind of oval, like softer lower face appearance is actually more favored, and we've talked about that in a recent video. Now, when it comes to the nose, oftentimes what's prioritized is improving the profile harmony. So that means how the nose sits with the midface and the lip. Also, tip refinement is a common goal when it comes to improving the nose. And the ultimate goal of any nasal surgery should be to bring attention to other facial features, such as the eyes. Non-surgically, the nose can be enhanced with the use of filler, but it has to be done with a lot of caution and expertise because there are blood vessels that, if injected, can potentially lead to very unfavorable consequences, namely skin necrosis and very rarely blindness. Surgically, a rhinoplasty can be performed that should preserve the dorsal lines. Nowadays, plenty of support is added in to avoid over-rotation of the nose and also to have the nose still maintain its structural integrity so it doesn't weaken over time. And when things are overdone, the nose can look overly narrow in the mid-vault. The tip can sometimes appear too pinched, and there's sometimes a mismatch of the size of the nose with the strength of the jaw and the brow bone. If these other features are quite prominent, having a very small sculpted nose may not fit with the rest of the face. So proper planning for any nasal modifications takes into consideration the positioning of the midface, the lips, and of course the chin. One needs to avoid over-resection and needs to provide adequate support for proper functioning of the nose as well. Keep in mind that one of the common reasons that people seek out a lip lift, for example, is because they've had a prior rhinoplasty, which can in fact lengthen the philtrum. So once they've had the rhinoplasty, they feel like the philtrum is too long and they look to shorten it with a lip lift. Now let's talk about skin, tanning, and makeup. People are looking for that improved texture, glow, and a more uniform tone, especially when they're in front of cameras and bright lights. Non-surgically, people are using all types of skincare, including our Feel Confident products, radio frequency with microneedling, and also light peels. Surgically, laser resurfacing is possible with various types of lasers, such as ones that employ CO2 type of energy or erbium YAG, and various types of deeper peels are possible but should be performed in expert hands. And when things are overdone, it can appear that some people get these harsh contour bands. Deep spray tans and bright veneers can give a mask-like appearance, and shiny malar highlights can sometimes bring out the underlying filler a bit too much. So to keep things natural, it's important to soften the highlights, to keep the tone even, and to avoid rigid contour lines that highlight filler planes. Now we know that the hairline and one's eyebrows can have a huge impact on how they're perceived. Non-surgically, people use styling products, different types of density powders, and sometimes microblading or scalp micropigmentation. Surgically, hair transplants can reframe the hairline. They can also bring more hair into the eyebrow area, for example. Hairline lowering is also possible in the right candidate and can sometimes be combined with brow lifts. And remember that a hair transplant can be done into a scar along the area where facelifts are performed, for example, or where a prior brow lift may have been performed and now there's a scar behind the hairline that can be filled with grafts. That can both mask the appearance of the scar and it can actually make the scar a bit healthier in its appearance and in the way that it feels. And we have a video dedicated to how we perform hair transplants into scars if you want to check that out. And sometimes hair can look a bit artificial. When ultra dark dye, for example, is used on lighter skin, there's that extreme contrast that can develop. Also, sometimes a hairpiece might be used and that can give off some unnatural type of appearance. And some hair transplants are performed in a way that doesn't necessarily give off a very natural look. So it's important to consider where you're going for these procedures if you are seeking them to help improve the hairline. As I often say, hair transplant surgery is art. So pick a good artist when you're looking into this type of work. And when it comes to hair care, we often begin with a low maintenance polish. Things like scalp care and styling before we ever get to any needles. Our Feel Confident routine supports hair and scalp care and is now available on Amazon. Weight change is another important consideration, especially in today's world of GLP-1 medications. Rapid weight loss will thin the face and the neck, and it can sometimes mimic jawline procedures by enhancing some of the underlying bony anatomy. And if someone is considering non-surgical or surgical aesthetic modification to the face, it's important to have weight stability before you undergo any of these procedures. Otherwise, results can be more variable and more difficult to predict. So what do you do if you already look overdone? The first step is to reverse what's reversible. That could mean something like hyaluronidase to dissolve your HA filler, and it could also mean just letting time pass. Like if you have neurotoxin in your face or have had a prior fat transfer and you're looking for some of that fat to start to melt away, sometimes just giving it time is the best way to go. Also, if you have an implant in that's starting to look less natural, it can be removed, and that can restore you back closer to your original appearance. The second step is to restore structure. That can be done through facelift or neck lift surgery. It can also be done with the use of various implants when indicated. And the third step would be to relayer minimal volume. The goal is to return attention back to the face as a whole rather than increased emphasis on any one part. If one feature steals attention, it's important to dial it back. There are, of course, costs associated with many of these procedures and with the constant upkeep and maintenance of them. For injectables, neurotoxin is usually performed 3 to 4 times a year. HA filler might be performed every 6 to 24 months, depending on the area and the type of filler used. Surgery, of course, will have larger upfront costs and longer downtime. And the longevity of the results will depend on the type of technique used for surgery, the actual tissue quality, and the speed at which one ages. But remember, you don't need to spend $300,000 for a quality facelift procedure. The goal isn't to spot who's had work. It's to understand why some results distract, while others quietly elevate you. If you've learned something watching this video, please make sure to subscribe to my channel. Thank you.